Last week we were very lucky to have quite a few updates from Charmain Arbouin, our British Consul, on all the things that are affecting us expats living abroad, not just Brexit, but so many things, getting older, being unwell, etc., etc. Check out last week's programmes. We're not going to go there. But one thing that we both realised was important to talk about, but we didn't get round to, is mental health. And as we're here in the Via Padierna, and this week's a golf week and wanting to get youngsters involved, you mentioned that golf actually is on the list of things to improve or maintain mental health.
Yeah, I mean, it's really
Hello, by the way.
Hello, Nicole.
Sorry.
Thank you for having me back again.
Sorry about that.
So, golf, like any exercise, is really good for your mental health and for your well-being. And it's interesting for us in the consulate because quite often, from two angles, we deal with quite traumatic cases. Sometimes we deal with deaths, with murders, with rape, sexual assaults.
Because I was actually wondering what kind of issues would come up with the consulate.
So, and of course, if you're dealing with people as a professional, it's really important that you don't kind of get drawn into that. But inevitably, you take it home with you at the end of the day. You're not going to forget that child that died and how upset the parents were. So for us, it's really important that our staff consider their mental health and their own well-being. But also, of course, we have lots of customers who might have mental health issues. And it's really interesting because whenever I started to work in consulate, we didn't really talk about mental health, and it's no different from anywhere else in society where there is that stigma attached to it. So we would never see somebody that had a broken leg and not comment on it, but we might notice that somebody had mental health issues, but somehow it's not something that you want to talk about.
It's taboo, exactly. You don't go there.
Right? So interestingly, it was when David Cameron was Prime Minister, and I don't know, I have a sense that it was because there were some family and mental health issues that for his wider family. And so he sort of started to champion mental health, and he encouraged civil servants to think about mental health and to take time to ensure that we have reasonable mental health.
It's funny because just talking with Natalia from the Butterfly Skin Children, she's a social worker, and she said part of their training was actually how to protect themselves from the horrors of what they're dealing with sometimes.
Exactly. And
you poor girl, things you have to go through.
Yeah, well, I'm the consul, so I actually don't, it's consular officers that deal
really
with it day in, day out. Of course, when we think about mental health, we might, like I sort of think, what do people think about? They think about bipolar or depression, but there are lots of things, including things like Alzheimer's. And everybody has mental health. Sometimes we have good mental health, sometimes we have poor mental health, and sometimes we're in between.
But stress really is a very big factor in this. The more stressed you are, the more confused, you can't think right, everything then starts like going off course.
Exactly, and the important thing, I mean, it's quite interesting because I was shown something that sort of said, we traditionally think of people either having good mental health or poor mental health, and that's it, either you're mental, you've got mental health issues or you don't have mental health issues. Actually, people quite frequently move between them, and there are big things in our lives, and sometimes they're not even big things, they can be an accumulation of small things that will affect our mental health. And the obvious things tend to be bereavement, it doesn't mean that you're crazy because you feel depressed, because
you're crazy with despair.
Exactly. And that's normal, and it can be, you feeling depressed is a normal response to that. But the important thing is then how you recognise that and how you deal with that.
Recognising it must be the hardest part, that people don't see themselves, because if you're in it, you're not aware that you're in it.
Exactly. And sometimes it requires someone from outside. And I suppose one of the big things that I've learnt, and I recently, I think it was probably in June or July, I did a half-day workshop on mental health first aid, which I'd never heard of this concept before. And mental health first aid is basically the support that you get before you actually seek professional support. So some people will need professional support, but actually lots of people just need somebody to say,
I want to talk to.
Nicole, how are you? You know, you seem a bit down. You don't seem like yourself today. I know that's not true, but you know, you don't feel like yourself today, and it might just be that you need the opportunity to say, yeah, actually this has been happening, or I've been really down about that. And just that talking to somebody could make all of the difference. And maybe all I say to you is, oh, well, you know, I'm here if you want to talk about it. Or maybe I say, oh, have you ever thought about talking to someone about it? Maybe a counsellor or whatever. Sometimes some people just need permission to
or don't they maybe feel that they're being too wrapped up in themselves and that they should get on with it kind of thing and not take it seriously? I imagine in the Consul, for example, if you've got a busy day working and you've been dealing with all these horrors that, again, can happen, that you're not preparing to feel, you know, off of sync kind of thing.
Exactly, and we tend to, I mean, I don't know if you
Where
remember...
would someone go then?
Well,
sorry, I didn't mean to interrupt.
In terms of in our workplace, we have lots of support systems. So we have an employee assistance program, and people can just phone that completely confidentially. They don't have to go through their line manager. You could just, and it doesn't have to be even anything to do with work. It could be that you're going through a relationship breakdown, or you have financial problems, and you just want to talk to someone, and you can phone. All of us at work are able to phone the employee assistance program, and it's an outside contracted arrangement.
Right, so there's no,
and they don't, you know, they're not going to tell anybody. They don't know who you are. You know, it's just somebody confidential for you to speak to. We also have, obviously, there's a line management system. We have first response officers, so there are people who have been trained that you can go to who aren't part of your immediate work team, but lots of people don't want to even do that because they don't want to speak to people that are in their organisation. And we actually pay for another company to provide. They have a set number of sessions, and you can either speak to them face to face, or you can just call them, or you can have a video conference with them. You know, and we will always kind of look very sympathetically on anyone who wants to take time out, or if anybody sort of says this has happened to me. But we also do this thing which is called TRIM training, and I don't remember what the acronym stands for. But anybody that's been involved in a traumatic incident has a right, and more or less they're actually obliged to speak to somebody after that incident so that they can download it. And the evidence is that if you, like firemen for instance, perhaps the firemen that worked in the Grenfell Tower, if those people that left and went away and spoke about it to professionals will have done a lot better than those people that left and just went home, yeah, and tried to deal with it themselves. Because it's not always immediately after the traumatic incident. Sometimes it could be months and months later. When we dealt with the Barcelona, do you remember the Barcelona incident last year? And we had some staff from Malaga that went along to provide a little bit of resilience. And afterwards, when they came back, and of course the dreadful thing is they come back and they're just back at work. You know?
As if nothing happened.
Yeah. And it's like, no, you need to have a time out, and then after a few days you need to speak to somebody. And it's fine if there's nothing that you want to say, that's absolutely fine. But you need to allow people that space to you know, and that permission to actually say, actually, this was really awful. And of course, I don't want to go home and talk about the dreadful things that happened in my day to my children or to my husband. You know, it's better that I go speak to somebody that's, you know, that's there to actually deal with that. And
the more you're talking, actually, the more significance it's making of, obviously within the consulate, to have people who are in their right mind, in the sense that you are so responsible for so many other people, yeah, and in important issues and things that really are life-changing for many people, that it's really nice to know that there is that support system, because anyone just on a day-to-day life, we know how difficult it can be. But if you're also then responsible, as you are, for Andalusia, Ceuta, Melilla, I mean, there's a lot of people,
yeah,
especially at this time of year.
Exactly. You want me in my, you know, you want me at my best, really.
Exactly. Not worrying about other issues,
yeah,
and you can't exactly to at least have that opportunity.
But that's the same for all of us. You know, that would be the same for your, you know, for your viewers as well. That all of us have important things that we have to do, if it's looking after our children or whatever else, and you need to make sure that that you're fit to do that. And sometimes that means just taking that time out. I think the best analogy for me is, when you're on an aeroplane and they do all of the sorts of safety features, and then there's always that bit where they say, if you're with children, make sure that you put your own oxygen mask on first. Yeah. And of course, for those of us that are responsible for children, our immediate reaction would be to look after them first. But it's really important, because if you don't look after yourself first, then you're not in a fit state to look after anyone else. So
run that all the way through.
Yeah, exactly. So my kind of advice to people is really very simple. There are lots of organisations out there that you can just, you can just Google them online. There are ones that are for specialist illnesses like dementia or Alzheimer's. But there are also people, like the Samaritans. There are all sorts of people that you could just call and speak to. And my advice is don't make it a taboo. If you notice that your friends or your neighbours or whatever are behaving kind of not in the way that they would normally behave, and I can't think of a concrete example, but we all intuitively notice whenever people are slightly different to the way that they normally are. Don't be frightened to ask, and it doesn't have to be a really intrusive question. It could just be, how are you, Nicole? You seem a bit under the weather today. You okay?
A bit of empathy, a little bit of just a time. And this again is like with the elderly and people on their own solitude, feeling that you are alone, that you don't have people to talk to. Marbella is blessed because we have so many associations and little groups as well, that if you don't want to go to a medical level, you can start off by just trying to make a few friends.
Exactly. And the other thing that I would say is that increasingly mental health is an issue for younger people as well. Young people, teenagers that are under a lot of stress. I mean, now's the kind of, we were talking about, it's the end of the exam season, everybody's waiting for their results, and then if they don't get the results that they want, there's all the stress of what do you do next. And it's really important to just look out for the signs, and there are all sorts of things. It can be somebody just feels a little bit strange to you. It can be that you think that they're depressed. It can be that they stop talking. It could be that you notice that they're drinking more alcohol than they did before. With young people increasingly, it could be that they're self-harming, So none of us have to be experts, but all of us can be good neighbours.
I think that's a beautiful way of putting it. We're actually talking about that earlier, in the sense of sometimes we're all trying to be the British consul or this one, or I'm the head of this, or I'm the department manager of that. At the end of the day, we're just people doing the best we can to help other people. And if we remember that,
exactly,
then we're all okay.
Brilliant.
Thank you so much, Charmain.
Thank
Lovely
you.
to catch up again.
Yay.
And now, as I say, looking after our mental health, we're just going to enjoy ourselves at the Beer Padiana for a while. Sorry.
Thanks.
Hey, hey.
Free taxi 4 times a month and 25% discount on your car insurance if you're the Zero Hero.
Yeah, I'm here in Marbella, but it says here I'm in La Canada.
If you haven't mastered the lingo, don't worry. Linear Director has a free GPS geolocator service that will come and find you.
Hey, hey.
Good afternoon, here we are again, and today I'd like to present you AAA. We're at the location itself, which is in the road to Ogen, and I'd like to talk a little bit about sterilization. Every year, 150,000 dogs are being abandoned in Spain, and that is every year. Most of those dogs end up in shelters like AAA. And the trouble is because most dogs are not wanted. The problem is that a lot of people in Spain don't realize that sterilization is a good thing for dogs as well as cats. And they just keep the dogs without sterilizing them. They go free in the campo or wherever, and they mate, because that's what dogs do when they're not sterilized or neutered. And then they get a litter of puppies. They don't want the puppies, and so they end up either on the street or in the garbage and end up in shelters if they're being found. So a lot of those dogs also end up in municipal shelters or municipal perreras, and they are killing stations. If these dogs are not adopted within about 10 days, they will be put down. So you can imagine, from the 150,000 dogs that are being abandoned every year, a large part is put down unnecessarily because of non-sterilization. So if you can see here, if a dog is not sterilized, we will have 67,000 dogs in 6 years' time. So please sterilize dogs. It's not only good for non-overpopulation, but it's good for the dog. It's for their health very important. Dogs that have been sterilized usually live longer than dogs that have not. Dogs that are not sterilized have a chance to get cancer, either tail bell cancer or mammal cancer for the female dogs. So sterilization is the only answer to getting rid of the overpopulation, to keep healthy dogs, to keep them inside so they won't run away. The same with cats. We have a large program going where we sterilize the street cats. We've done more than 6,000 cats already in the last few years. That's because Javier, our cat man, is going around catching all the cats, bringing them here, have them sterilized, and put them back. Because the cats that come from outside, we cannot home them because they're wild. But at least they're sterilized and they will not reproduce. So sterilization, entering the dogs and the cats, is really the only answer to getting rid of the overpopulation of the dogs and cats in this country. Thanks very much, and remember, don't shop, adopt. See you next week.